COVID cases and hospitalizations continue to rise this summer, but updated COVID vaccines are expected this fall. To date, almost 70% of the U.S. population has completed their primary vaccine series, but just 17% has received last fall's updated dose. That's very low. With more on this and other big medical news of the week, we are joined by, our resident medical expert, board-certified ER Dr. Michael Daignault. Doctor, always good to see you. So bottom line is we have a new COVID vaccine coming this fall. This will target XBB.1.5. That seems like that was a variant a while ago because now we have EG.5 that has now become a variant of concern. So with all of this said, do people, if you want to get this updated vaccine, should you wait for the fall, the new one, or just get what's available now?
So the last booster that we had came out last fall, the virus had already mutated multiple times, so it wasn't really a great match. This one, although it does target XBB.1.5, most of the variants in the country now are the XBB family. And the new one that you mentioned is a derivative, a combination of XBB.1.5. So that being said, it's going to be a better match than the previous one. And so with the previous one, it did provide some protection, especially against severe illness, but maybe not against, basic symptoms, just getting sick. This one will be a better match, I hope, for covering all potential symptoms and illness.
Okay, so I know that we sound like we're speaking a different language with the XBB and EG.5.
Right.
But for people, though, I mean, if they haven't gotten vaccinated in a while and they are curious about it and they do want it, should they wait till the fall? How do you know?
I think we should wait. I think most people should wait because now we just found out last week the CDC director in an interview on Twitter said that it should be available in the 3rd or 4th week of September, which is next month. So it's better to wait for the better matching vaccine than to rush out and get the currently available one. Okay,
and then the question is who is eligible for it, because we know that we haven't issued those guidelines yet. The CDC will put out those guidelines soon enough, but the UK has made it clear who they think should get the booster. It's very targeted in the UK. Is that a sign for what's to come for us?
Hopefully. What I loved about what the JCVI did, which is the UK equivalent of the CDC, is that they made it very specific for people over 65, people with chronic medical problems, people in nursing home, and those working with people in nursing home, and particularly for people who are immune compromised and their household contacts. So if you live with somebody who's immune compromised, like an elderly grandfather or parent, and then those that work on the front lines like myself. For those who are under 65 with no medical problems, they didn't recommend that people get it at this point. And
I think,
right, so that's very targeted. I like that approach. That's recognizing that there's a lot of hybrid immunity already in the country and the world. The people have had multiple doses. They've probably been vaccinated. I mean, it's probably been infected whether they knew it or not. And so I'm hoping that the CDC follows that targeted guideline.
Okay, we'll see. Here in LA County, the LA County Department of Public Health, they really did quietly lift both the vaccine and the mask mandate for health care workers in LA County. They did this over the last 2 weeks. This includes you. You don't have to wear a mask anymore.
Right.
There's no mandate to do it. There's no vaccine requirement for LA County healthcare workers. What do you make of this?
Well, this was always about just giving the healthcare professionals the autonomy that, we think we deserve. We've been educated, we've been trained, we know what our risk is when we walk into a room, whether or not we want to wear a mask. And so even though the mask mandate is gone, what I'm seeing lately and what I saw the last couple weeks at work is that my colleagues are wearing masks when they go in the room just because they recognize that we've been surprised recently, like a patient comes in, elderly, non-COVID related symptoms, weakness, fatigue, end up testing positive. And so they've been masking up more just to protect themselves. Regarding the vaccine mandate, I mean, as early as, 2 winters ago, when we first had the Omicron outbreak, that's when the majority of healthcare workers got infected. And both California and LA County at the time were mandating that 3rd booster, which to me never made sense. People got infected in January, you're saying you still got to go and get this booster update. And so it's never really made sense. They never really recognized the importance of hybrid immunity. From the beginning, in hindsight, what they should have done is said, if you've already been infected, maybe just get 1 booster instead of trying to get everybody 3 shots, regardless of whether they got infected or not. And so I'm glad, both of those mandates have gone away.
Yeah, and we should also point out that the COVID levels are still really low.
Correct.
Really low in terms of cases and hospitalizations.
Right, the ER is not overwhelmed, the hospitals are not overwhelmed with COVID right now.
Absolutely. Okay, Dr. Michael Daignault, thank you as always.
Thank you.